Hi, my name is Melissa, and full disclosure, I work for Dr. Woodruff. Being in his office for the last 15 years has been a special privilege because I got to see neuromuscular modulation created from the ground up. And I have the day-to-day privilege of seeing patients get relief from their pain and talk to people that have canceled shoulder surgeries or knee surgeries because neuromuscular modulation has completely taken away the pain. I talk to patients that are willing to drive 600 or 700 miles to see Dr. Woodruff and experience neuromuscular modulation. And my day-to-day routine at the office is pretty great. But I tell my story today not as Dr. Woodruff's office manager, but as a mom. My son was breech for most of my pregnancy, and he was delivered through a scheduled C-section. And the pediatrician that examined him said that he had severe torticollis, which is that painful condition where your neck is craned to one side and the muscles get tight and angry. And so I had to sit there in that hospital room and see my son, hours old, crying and screaming and knowing that he was in pain. And thankfully, Dr. Woodruff came to the hospital to visit us, and my son received the benefits of neuromuscular modulation when he was less than a day old. And throughout the next few weeks, we saw Dr. Woodruff regularly, and the neuromuscular modulation changed him. We got to see his neck look more normal, his demeanor changed, and honestly, we forgot about the torticollis as he grew into this busy and happy and smart and wonderful little toddler. And then shortly after he turned 3, we noticed a disruption in his sleep patterns. He would go only for a few hours, and then he would wake up screaming and just crying, and there was no consoling him. And this happened every 2 to 3 hours all night long. And this happened for less than a week, and we didn't know what was going on. We thought maybe it was night terrors. We thought maybe it was growing pains. But when it continued on throughout the day, then we realized there was an issue. So I called the pediatrician and scheduled an appointment, and we were set to go in the next day. And that evening, he was screaming again, just uncontrollable screaming and crying. And this time, he was able to verbalize it. He said, "My head hurts, my neck hurts." And so I touched the muscles on his neck and shoulders. And now I'm not a doctor, but like most people, I do consult Dr. Google. But without even a medical degree, touching those muscles, I could feel how tight and angry those muscles were. I grabbed our mini massager that we keep at home, and I used the neuromuscular modulation technique on him. Dr. Woodruff has shown me the pattern to use, and I've seen him apply it to patients over the years. So I started on his right side, and gradually the crying stopped. And by the time I finished his right side, I could see a difference between his right side and left side in the tightness of the muscles. And then I moved on and I did the left side, and he was a completely different child. No more crying, no more screaming. He bounced up, ran down the hall, and that night he slept through the night, and we haven't had an issue since. Absolutely amazing. You know, it's one thing to sit at work and see these results from patient after patient. I mean, it's great to see so many people happy and getting relief from pain, but it puts it on a whole nother level when it is your child. And it was such a gift for me as a mom when I saw my son in pain to be able to do something about it myself and to not have to try to schedule a doctor appointment and wait until we could get in. I could take away the pain of my child. What a special, special privilege. I'm so grateful for neuromuscular modulation. And for those of you that are watching, I just implore you to learn this technique because it can change your life. And again, I say that not as Dr. Woodruff's office manager, but as a mom.